Afternoon, everybody. Most of you may already know me just from the previous two that we've done the last two Fridays, but if not, I'll just quickly go over. I'm a nurse by background as well as a certified professional coder and an ICD-10 trainer. Work with your health centers all over the country as well as your national and local PCAs. There's nothing legal. So really, we're just going to talk again. I want to reiterate a few things on how important you are. We're going to also talk about the importance of the sliding fee. We're going to talk about requesting copays, asking for payments, and what social determinants of health is and what it means and how you might be a part of that. So again, just to kind of reiterate, you guys are so important. You have so many things on your plate. Again, greeting, customer service, you're doing the telephone, you're doing face-to-face, you're doing a portion of billing. So again, you're doing a lot of different regulatory things with HIPAA, Medicare secondary payer. So you guys have a lot on your plate and you're really important in your health center. So one thing we're going to talk about today I want to do a quick poll first is your answer is either true or false. Leadership comes from management and supervisors. So I'm going to give you just a couple of seconds to answer that question on your opinion, if you think it's true or false. Just a few more seconds so everybody has a chance to do it. Just about 5 more seconds. Okay, great. It looks like 89% said false and 11% said true. So the answer is false. Anyone in your organization can be a leader, including you. You guys have a lot of responsibility, but you're also a leader in your healthcare organization. So when you're thinking about leadership and what that really means, it's really motivating a group of people to act towards achieving a common goal, right? So anybody can be a leader. The janitor can be a leader, your CEO can be a leader. So really, when you're thinking about that, each and every one of you play a part in the health center, and each of you can be a leader within your own respective job duties. So start taking ownership and really kind of cultivating that teamwork and stuff behind you. So when you start thinking about leadership, we're thinking about teamwork. So thinking about, do you all work together across all departments? Do you show respect? Do you have good health discussions? Or do you guys have more siloed, more people not engaged, kind of a little bit not as friendly? When you're thinking about staff, do the members provide compassion and listening and follow through to each other as well as to your patients? And then learning and development is also part of leadership. Do you focus on growth and development, both individually, but also in the health center? And do you have access to have better education and learning tools, for example, like this training? And then change. We all know that change happens and most of us don't like change, and I'm one of those people. But when we do have change, do we work together to get there, or is there a lot of bickering and delayed action because of it? So again, we're really thinking about like leadership at the front desk. So really kind of elevating your position a little bit. And so just as we talked about the first two series, you guys are so important. You are that first and last impression that that patient sees. How you handle things, how you own the waiting room, all of that is really key at the front desk. So you guys are super important. We know that the patient flow starts with you. We know that the billing starts with you. We know the education starts with you. So if you think about it, you already have all the key elements of a leader. It's just trying to elevate yourself to get there. So outside of that, we're going to go ahead and just dive into some other key things that are part of your front desk duties. I said earlier on the first two and this one that you really have some legal and regulatory responsibilities. So here again, what you have to know the state law, right? For minors, typically a general rule is a parent or legal custodian's permission is required to treat patients, but you have to make sure that you know the state law. If you don't know it, you need to figure out where to get that information. You also have other laws. So the American Disabilities Act, the ADA is how you might see that abbreviation. So again, we have to make sure that we offer interpreters to the patient without charge. That's hard sometimes because sometimes we don't have that or it's too hard to get them on the phone. So again, we have to make sure that we follow all of those laws for the ADA. Also for the limited English proficiency. Again, a medical practice may be required to provide somebody to interpret for that patient. We can't charge the patient, but we have to make it available. So again, in addition to HIPAA, MSPs, etc., you also have to have the understanding of other laws and state requirements. Sliding fee. So again, with the sliding fee, as you all know, we have to have that in our health center. And health centers have to establish systems for kind of developing the eligibility determination. So you guys should have board approved policies on your sliding fee. You have to know those policies at the front. So you know that you can't deny patients for inability to pay, but HRSA still requires that you attempt and really try to collect payment. So three things that you have to know. One, what do your board policies say? Two, download Chapter 9, which is the HRSA sliding fee guidelines, and Chapter 16, which is the HRSA billing and collections. It's going to be really important. So when you're thinking about providing verification, what does that mean? So proof of income, for example, certification of household size, proof of address. Also thinking about what is included in proof of income, right? So we're going to talk about each of those in a minute, and we're also going to talk about self-declaration and what that means. So when you're thinking about proof of income, for each household member that is 18 years or older, so thinking about your tax returns, like a W-2, or some people do paycheck stubs, dated within the last 30 days, some do 3. Again, you have to know your policy. This is why we need to have really established protocols and checklists for everybody in the health center. So if you have a separate call center, we want to make sure that those individuals know what has to be brought in when I am going to complete my sliding fee, so that we educate that patient in advance, because a lot of times our paycheck stubs are electronic and sometimes they can't get those downloaded on the phone. So again, we need to make sure that whoever is the first contact making that appointment, whether it's the front desk or the call center, that we have a checklist to go through. Again, if there's any indication that we might need a letter indicating what payment's been received from like VA benefits, Social Security, etc., unemployment letters, child support, all of these things are going to be key to my proof of income. Certification of household size. The patient needs to tell us each member of their household. So again, these are things that we need to educate the patient on. And sometimes it's really nice to have what we call like an outreach person that meets with those patients to go over what things they have to bring, what these mean, proof of address. How do they prove where they live? So again, just making sure we have somebody to walk the patient through, and then you at the front desk understand what these key things mean so you don't miss anything. What happens if the patient doesn't bring all their required documentation? So what happens if the call center forgets to tell them everything to bring? Or what happens if they told them, but the patient wasn't able to get it, or they forgot about it and they couldn't find it? So we can have what we call a self-declaration. which is good for that day's visit. Lab, imaging, everything from that day. The determination of that eligibility is going to be made once all the required information is returned. But this self-declaration is only good for that day. It expires the next day. So I want to give you an example of what that self-declaration might look like. So you can see at the top here, patient's name, date of birth, social security number. I certify the patient, they put their name here, Mrs. Smith is the head of household, etc. So they read this, they complete it, and that will cover for today. This is where really good communication comes in with our patients on what they need to bring before their next appointment so that we can make sure they have everything ready and we can figure out where they fall on that sliding fee scale. This is where communication is so key. What happens a lot of times is that patients come in, they don't have everything, they really don't understand what they're supposed to bring. At the front desk, you guys are super busy. We do the self-declaration if we remember, sometimes we don't remember, and then the patient leaves and nobody ever follows up. And then we have this ongoing issue of the patients not bringing what they need because they don't know. So sometimes it's really nice to have somebody from like outreach and enrollment meet with them, or a financial counselor or someone in your organization to go over what they have, what they need. Sometimes it's just showing them an example of what things look like and explaining to them. Prompt pay discount. So we can offer a prompt pay discount. What this means, if, for example, if the patient doesn't want to apply for the sliding fee, sometimes patients don't understand that, they don't want to apply, they don't want to give you that information, and maybe the visit doesn't go towards a grant, we can offer the option of the patient to pay a fee that's discounted and it pays in full. So what that means to you, you have to understand a prompt pay discount to make sure that we're doing it correctly. If I come in and I either A, don't want to apply, or I don't qualify for the sliding fee, and I don't have a grant that I can fall under like Title 10 or anything, something that you could say is, Shelly, today for your visit, if you pay in full, we'll give you an X discount of 20%. And let's say my bill total ends up to be, with the discount, $150. If I say, gosh, I can't pay all of that today, but I can make you 3 payments, $50 each. That is not, we can't do a same day discount if we're not paying in full. So then we would go back and say, okay, well, your total before the discount was $200 or whatever the numbers add up to be. So if you need to make 3 payments, we'll divide that 200 by 3 to get your 3 payments. So this is why, for you guys at the front desk, you have to understand a lot of the regulatory and the billing. You also create like a binder, put tabs on it. It is okay when a patient is in front of you to say, you know, Shelly, let me just double check our policy, so that you can look immediately in that binder and figure out, what is a prompt pay discount? What does that, you know, qualify for? What do they need for their sliding fee? So that it's easy, so you don't forget things, because you do have a lot on your plate. So make it easy for yourself. Everybody take something to work on and create a binder for everybody. Ask your management team to look at it to make sure it's accurate. It falls within all of the guidelines. It meets the board policies that have been approved, so that you have everything at your fingertips. Okay, let's talk about some other thoughts for front desk. So think about when somebody walks in and your front desk staff just hand them a clipboard and ask them to complete the forms. This is not uncommon. You guys are busy. This happens a lot. We don't even think about it. Second nature. We just, here you go. So what happens if that person's not even a patient? What happens if that patient can't read? Or what if they're not literate, so they don't understand some of the things on the form? What if they're only there for a lab or nurse visit? So really taking a step back And thinking about if you were in that patient's shoes. One of the key things I think is really important is if you can make it work in your health center, is instead of handing me a clipboard with a bunch of stuff to fill out that I have no idea what it is, what about me sitting across from you and you going through that form and typing it in as you go? That saves you time on the back end of trying to read somebody's handwriting. But that way you can explain to the patient at the very end when you're going to do like a final signature, where you can take that form and you can say, okay, Shelley, this is our HIPAA privacy form. This is what that means. The next one, this is our financial policy. This tells you that you're responsible for the bill, etc. You should have a 30-second elevator speech for all of those so that you can explain to the patient. But the more that you can do face to face, we're building a relationship with that patient. We're getting better patient satisfaction scores, but we're also really making a connection. Remember in the very first training, I said, I want you to make a connection, not a transaction. You're not Walmart. So have that patient sit across from you. Can you give me your address? Can you give me your phone number? Can we text you? Go through those key things in lieu of giving me a bunch of forms that I'm going to fill out. And if they write like me, you're not going to be able to read it anyway. So you're playing a lot of catch up on the back end because we don't know if it's accurate. So we're going to do another polling question. I don't feel like I have any idea what's going on at the health center I work at. And remember, these are completely anonymous. Nobody can see who's answering what. So I'll give you just a few more seconds. Just another 5 seconds to finish up, everybody. All right, it looks like most of you answered, not all of you, but it looks like 90% of you or 100% of you said that really won't work, but I think it's 90% that said false, 10% that said true. So this is not uncommon. When I go into health centers, a lot of times people tell me, I really don't know what's going on. It's hard for me because we don't communicate as a health center across the board. We're very siloed. So I'm a big proponent of everybody understanding a little bit about everybody else's job. Now, that doesn't mean I want the front desk to really understand the credentialing or the billing or the medical assistant's job, but to have an idea of what those individuals, their shoes they walk in, and vice versa, them to sit with you. I think it's important that if you can have a front desk person attend the billing meetings so that you can give input, but they can also tell you things that they're seeing on the back end. Because if we can streamline processes and make it more efficient, we're going to be better off ahead with efficiencies and money on the front end if we can get it all worked out and streamlined. In lieu of, if we're waiting on the back end and correcting things multiple times, we're losing money and we're losing efficiencies. So for all of you in the front desk and call center in any part of your job, I challenge all of you every day to kind of think about doing an ordinary job really in an extraordinary way. Thinking about what you in your job, what works really well and what doesn't work well and why. Most supervisors and managers love employees that have a solution, not just a problem. So when you go to your boss and you're like, we can't really be efficient because the copier is, you know, behind us 3 feet and we have to walk over there. So it's taking time. So I'd like to see if we can move the copier, the scanners up right directly behind us. So it may happen, it may not, but at least you're going with a solution. So it's really important for you at the front desk to think about what works well and what doesn't. Most of the time, you guys have great ideas. You have the boots on the ground, you're working that, you're in the weeds every day. So help your supervisors and your health center know how we can be more efficient and still really give great care, and we can give great internal client and external client satisfaction. Now, one of the things that health centers are really starting to focus on are social determinants of health. And so I'm going to talk about this, and you may, as we're going along, you may be thinking right off the bat, why is she talking to me about social determinants of health? We're not the clinician. But we'll start looking at this a little more in depth. So the first thing I want to do is just your thought process on, do you think social determinants of health are for physicians and like the clinical staff, and really not for scheduling and front desk staff members? So true or false? Or not sure. Sorry, I forgot that was on there. Give you just a few more seconds to answer. So when you're thinking about social determinants of health, do you think that they're for physicians and clinical team and not really so much for front desk and scheduling? True, false, or I'm not really sure. All right, so it looks like 80% of you said false, 20% was not sure. So let's look at this a little bit. So social determinants of health are really starting to play a part in multiple areas in the health center. So we'll talk about how it might play a part in yours, but first I want to kind of talk about what it is, right? You need to know the why. So when we're thinking about social determinants of health, and typically you're going to see the acronym SDOH. These are health conditions, or these are conditions like when the environment in which people are born, like where you live, where you work, where you play, where you age, all of that are part of your functioning, your quality of life, and your risk and outcomes. So when we're thinking about social determinants of health, typically they fall into 5 key determinants: neighborhood, your health and healthcare, social and community, education, and economics. So there's challenges in one or more of these areas that are going to impact this patient's health. So for example, if their education is lacking, that's going to impact their health. And so we're going to go through like what things would fall under each of these: neighborhood, health and healthcare, et cetera. But research has determined that issues that impact the healthcare access and quality of care are only really 20% of the overall impact on this patient's health. So when you're thinking about some of the social determinants of health, looking at economic stability. So what does the economic portion mean? Are they employed? Do they have an income to be able to afford good food, nutritious food, clothing? So all of these things, when they get their medical bills and they keep piling up. So this is why, again, that pre-visit planning is so key for you guys at the front desk. When you see that a patient is already has a balance of $100, let's get them on a payment plan. Let's not wait until they have $500, because now I'm starting to move into that economic issues related to social determinants of health. Neighborhood and environment. So when you're sitting in your spot at the front desk and you're looking at this, you're like, well, who cares about playgrounds and parks? How is that impacting their health care? Well, if that kiddo can't get out and run around and play, number one, they don't have good social skills, but number two, it could impact their weight. Diet and exercise is so key. Again, if they don't feel safe to get on the bus to come to your health center, public safety. Where they're living. Do they live house to house? Are they couch hopping? Are they living under a bridge? Do they have heat? So again, neighborhood and environment impact my social determinants of health, which impact my health care. Education. So I keep talking to you about sometimes patients may not be able to read or they don't have the literacy to understand what they're reading. Most patients aren't going to come up to the front desk and say, "Hey, front desk person, I can't read," or "I don't understand this." So you guys have to be really observant. When you see a patient just kind of staring at a form, more than likely they can't read it or they don't understand it. So if you're not able to do that patient front desk face to face where you're typing the information in as they tell you, but you see someone sitting in the waiting room just doing this, go out and just say, I can help you with that. There is so much information on that form. It might be a little bit easier if I go over it with you. That gives them some dignity and it lets them know that you can help them and they don't have to feel uncomfortable to come up and say they can't read it, or they don't have to feel like they just leave it blank. Obviously, language is definitely a social determinants of health, because if I have a language barrier, again, my education, am I educated enough to know when I need to see the provider or when I need to call or take my medication? All of those things impact social determinants of health. Food and nutrition. Again, do I have access to healthy options? Do I have the financial and economic ability to buy food? Am I going hungry? Is my kiddo going hungry? All of these things are key. Social integration. So when you're looking at social and community. So again, can my kiddo get out and play? Can I have adult conversations? Do I have support systems around me? All of this is part of social determinants of health. So you can see there's a lot of pillars and they all impact each other. My health and healthcare. Do I have coverage? Do I have money to pay? Do I feel like I have access to get in when I call to make an appointment? Do I feel like I'm getting quality of care? Do I feel like that the provider and the health center that I go to is understanding of my culture and my ability and my social supports and things like that? So for you guys, really thinking about all of these things in the back of your mind. Now, you're not going to be responsible for all of these, but you might start seeing some. So, for example, what we're starting to see is some health centers are starting to distribute questionnaires to patients on the front end at the front desk check-in. So it could ask about their home status. Where do they live? Like, are they homeless or not? Are they a veteran? So we might see more and more things going on this screening for social determinants of health at the front end. So you need to be aware of what this means and why we're asking. Because if a patient comes up to you and asks why you need this form completed, you can't just say, well, it's our policy. You can, but that's not really going to answer the question, right? So you have to be able to make sure you understand. So maybe something like you might say, Mrs. Smith, the reason that we're asking some of these questionnaires is we are trying to determine what other support systems or what other individuals we can connect you with. So for example, if you're having a hard time, getting access to good, nutritious food, we can make sure that a caseworker meets with you and helps you determine where you can get good, nutritious food. So having that 30-second elevator speech, and this comes from practice, role playing with each other. You've got to know everything that you ask the patient to complete. You have to know what it is and why they're doing it. So I challenge each and every one of you to give your own self those forms. I don't really care if you completely fill them out, but go through each one as if you were filling it out. Do you know what it is? Do you know why you need it? So could you tell your mother, I have to fill this out and this is why they need this? I have to sign this and this is what I'm signing. So really go through all of those forms. And if you are unsure what any of them are or why you're doing it, you need to figure it out. And I even just would tell you, like, if this were your financial policy, figure out what it says in a nutshell and then right next to it, like in a marker, a 30-second elevator speech. Our financial policy states blah, blah. You don't have to read it verbatim to the patient, but you need to have an understanding. That way, when somebody asks you, You can explain it. Versus if I walk up and I say, gosh, what is this form? That's the HIPAA form. Okay. What is a HIPAA form? Well, it's Health Insurance Portability and Accountability Act. Okay, what does that mean? So you can see, just because you can read what it is, you have to know the details of what it is. And can you tell me that in a quick spiel? This is our privacy policy. This ensures that we don't give any information to anybody that calls about you other than, clinical people that are taking care of you. But if you put your husband on there, that's the only person that we would give that information. So if your son called, we would not be able to give them information about you. So again, just a quick elevator speech. Make sure you have resources in your office, posters and flyers about access to, different like farmers market, grocery stores, community centers where they can go in and exercise, soup kitchens. Those are things you could have in your office. Think about, do they meet with a navigator? Should they meet with a navigator? So your new patients, are they meeting with somebody from O&E? Are we calling our new patients and telling them what we expect of them and what they can expect from us? So these are all things that we need to be thinking about at the front desk. How can we make it easier on the patient and on the flow? So when you're thinking about some other things that you guys may see from the social determinants of health, you may have forms, as I said earlier, that may ask questions like this. What is the highest level of school you've finished? How hard is it for you to pay your very basics? So the patient may ask you why you need to know this. Well, why do I want to know how hard it is for them to pay for their basics like food, housing, heat? Because if they put pretty hard or somewhat hard, I want to connect them with somebody in my organization, like a caseworker or someone to help them hook up with the soup kitchen, or somebody to get them housing or medications, things like that. So you guys have to know these things because you're going to start seeing more and more of them going on like a screening form at the front desk. You might see other questions like this. In the last month, have you slept outside in a shelter or a place not meant for sleeping? In the last month, have you had concerns about conditions and quality of your housing? Have you moved from one home to another, and how many times in the last year? So again, if you don't know if you have a form that's being given to the patient, if you're just giving them the forms and you don't have any idea, first look at those forms. And if you're not sure if any of them are related to social determinants of health, make sure you start asking your manager, do we have these? Where are they? Why do I need to give them to them? What do I tell the patient if they ask me? Those are things you start thinking about. Other things that you might see in questions that we see a lot. Do you worry about that your food's going to run out before you get money to buy more? And the last year, the food you bought did not last you and didn't have the money, and you didn't have the money to buy more. You can't afford to eat a balanced meal. So again, you might start seeing more and more of these come on forms at the front desk. We don't really ever think about how social determinants can impact if a patient's on time or late. So some health centers, and I don't, again, know yours, some health centers have, if you're not here by 10 minutes, if you're 10 minutes late or 15 minutes late or 20 minutes late, we're not going to see you. No ifs, no ands, no buts. There's other health centers that will see them. Other health centers will make them just sit and wait, and if we can work them in. So really, we have to start thinking about this, because sometimes the reason I'm late could be related to one of those social determinants of health. Transportation. I didn't have money for my gas. I didn't have money for the bus. I couldn't get to the bus. I didn't have anybody to watch my kids. So really starting to understand when patients are late as to why. So again, when you're doing some pre-visit planning and looking to see like if those patients have been no-show patients or late patients, maybe making a note to have somebody meet with them to figure out why are they no-showing, why are they coming late, so that we can really start working with them on, do they need a bus, ticket, or do they need a gift card for gas, things like that. So again, it's being observant and intuition, using your intuition about things that you're seeing. So you really have to elevate yourself to say it's more than just sitting there typing the information in and greeting patients. So let's talk now about what you guys love to talk about, which is hard for everybody, right? Is let's talk about collecting money. So one of the things that's really hard for front desk is asking for money. It's not comfortable, and so it kind of puts barriers between us, and we don't ever really practice, and we're never really trained. So role play, and you have to anticipate, what is that patient going to tell you, right? So Mr. Smith comes up today and I have already pre-visit planned. I know he has a balance of $25. So we tell him on the phone to bring it. And then he walks in and I say, Mr. Smith, it looks like you have a balance of $25 today. Will you be paying cash, check, or credit card? And I sit quietly. Two things happen. Mr. Smith sits quietly and looks at me and I get really uncomfortable and I say, oh, that's okay, we'll just bill you. Or Mr. Smith goes, I don't have it. What we see in the health center is typically we go, okay, that's fine, we'll bill you. So when Mr. Smith says, I don't have it, thinking about way in advance, because we anticipate that the patient's going to say that, we want to have a reply ready. I don't understand why you don't have it. We told you to bring the money when your appointment was made. You can do that very friendly. The second bullet is not a good comeback. That's okay, we can just bill you. That's not really great. That's okay, just bring it next time you come. That's not really great. I understand you forgot it today. If I give you an envelope, can you drop it off by Friday? Ooh, that might be a little bit better, right? So what about when patients indicate they don't have money or they didn't bring it today? What about responding with, I understand, Mr. Smith, how long do you need to pay? And sit quietly. Let Mr. Smith tell me. Or what about that? I understand, Mr. Smith, can you bring it to the clinic by Friday? I can give you an envelope. Or what about, I would be happy to take your credit card and you can let me know what date you want me to charge it. You want 2 or 3 of these, because let's say you start with, I can take your credit card. And Mr. Smith goes, I don't have a credit card, or gosh, my credit card is way maxed out. I can't do that. I don't want you to be able to just say, okay, sorry, and end it. I want you to be able to say, I understand. Can you bring it to the clinic by Friday? I can give you an envelope. And sit quietly. We really want to start challenging our patients twice. Most patients have learned that if I come in and I don't bring it, or if you tell me I need to pay it and I say I don't have it, most of the time, most health centers and the employees just say that's fine, because it's uncomfortable. We're not prepared. We know that most of our patients are going to say they didn't bring it or they don't have it. So challenge them a little bit. Oh, I don't have any cash. Oh, that's okay. We take credit card, debit card, check. Which one of those would work for you? Oh, I don't have any of those. I didn't bring any money today. My husband has a credit card. I don't have a checkbook. No worries. Why don't I give you an envelope? Can you bring it back to me by Monday? And make a note. But the key is we have to follow through, right? So when we need a tickler, when Friday Mr. Smith doesn't bring in his payment, I'm going to call him on Monday. Mr. Smith, remember you had indicated you were going to bring your money Friday. I gave you that envelope. I didn't find it. Can you tell me if you brought it and who you left it with? And sit quietly. Patient presents for care and they check in at the front desk for a reevaluation. We tell them Mr. Jones, your copay is $25. How would you like to take care of that today? The patient says, the doctor told me I wouldn't have to pay today. That's not an uncommon thing we hear. So we should already anticipate what we would say if someone says that. So what about the doctor is wrong? I don't think we'll say that, right? How about, I'm so sorry your provider told you that. I know they want to make sure you get the best care, and sometimes they don't realize the rules we have to follow to comply with the regulatory requirements. How much can you pay of the $25 today? And just sit quietly. So it's really for you guys to start anticipating what that patient is going to say, what kind of comeback they're going to say. When you state something like, I see your balance today is $30. How would you like to take care of that? So it's not like you owe $30. That sounds a little more direct, a little more abrasive. I see that you have a balance of $30. How would you like to take care of that? And I'm just going to sit quietly. Or how about, how would you, if a patient has a $10 copay, looks like you have, I see you have a $10 copay. We take cash, check, or credit card. And just sit quietly. You should have already anticipated the most common like rebuttals you're going to get are, the doctor told me I didn't have to pay. Nobody told me to bring my money. I don't have it. I don't get paid until next week. So you should already have some key things that should roll off your tongue when those patients have that rebuttal, because we want to make sure that we're trying to get our money. If we just start saying, oh, that's okay, just bring it next time, or yeah, we'll just bill you, it's no problem. What happens is we're creating, it's okay not to bring your money. It's okay not to pay. We don't expect it. And then we spend, $30 to collect $20 because we print it on paper. We put it in an envelope. We put a stamp on it. We send it out. It either comes back, it gets thrown in the trash. So we do it again, send it out. Sometimes we do this 3 times. It goes to collections, or it doesn't go to collections, but we keep looking at it to see if it got paid. So we're spending $30 to collect $20 and we're in the whole 10. So it's really important we're starting to push in that way. This is a new year. It's a really good time to start that. And, when that patient goes, well, I've never been asked to pay before. Shelley, I totally understand. We have not been really good about trying to collect the money that we're owed. We're not a free clinic, as you know, we're an affordable clinic. And in 2021, our goal is really to start collecting so that we can make sure we have really good staff, really good equipment, and we have to be able to collect money or we're not going to be able to keep the clinic open. And then sit quietly. So just practice role playing with each other. So one of the things I do want to do, and Devin, you might have to do this. I don't know if I can do it from here, but can I do like a video and make it work, the sound?
You should be able to. You just have to choose to share the sound through your screen.
Okay, how do I do that? Sorry, guys.
Just go to good question. Can't see which. Let me see if I can pull it up real quick.
Okay. I think this video is really it's good for your team. It's kind of over the top, but it kind of sets the stage for patient care related to customer service. Do you want me to just send you the link? Would that be easier? Or
I think
you
I got it pulled up yet.
okay, perfect.
It's a dog's world.
Yeah.
Okay.
Do you need me to unshare my screen?
Yes.
Okay. Perfect. I want you guys to listen to this and really kind of just take it to heart. I think it'll really kind of just tie all 3 of these together, and then we'll kind of go open it up to questions.
All right, you able to see?
Uh-huh.
Max! Oh, Max! Dr. Ross is going to take good care of you.
We can see Max now. Dr. Ross will be with you in just a moment.
Okay, come on.
Sometimes it seems like good health care has gone to the dogs. The truth is, how a patient feels about their healthcare experience isn't based on technical expertise alone. It's largely the result of good customer service.
Pearson?
No, Peterson. Robert Peterson.
Okay, you're the flu shot, right?
No. I came in
Here,
because...
fill these out.
I've been to this office before.
That's not possible.
What?
That's not possible, ma'am. You'll have to get an authorization.
In It's a Dog's World, 2nd edition, watch as Bob is treated like a dog by his healthcare organization, while Max gets the royal treatment at the vet.
Mr. Peterson, let's just see what the problem is today.
I injured my shoulder. It was silly, really. My dog and I were jogging this morning.
Turn around. Okay, you can get dressed. We'll need an x-ray.
Oh, excuse me. Is this where I go to get an x-ray?
Radiology's in the north wing, sir.
Yeah, okay, but where is that?
Yeah. Looks a lot like my brother's shoulder. A football injury. Ruined his whole career. Had the best doctors in the world, and he never got his full mobility back.
As patient satisfaction scores become increasingly transparent, healthcare organizations need more training in the area of good customer
What? Is
service.
there something wrong with my blood pressure?
Bring him back in a week for a splint check. Let's see how he's doing then.
Thank you very much, Doctor.
My pleasure.
So join Bob and Max for this painfully funny video with some serious lessons about patient satisfaction.
Perfect. So you guys can see, and I'll share this when I send the slides over, but how really, key things are and how patients perceive. So really like putting yourself in that patient's shoes, take turns kind of just one on a busy morning. And I know sometimes it's hard, but sit in the waiting room to see what that patient's experiencing. Sometimes we don't even recognize how things are going because we've done it this way for so long. We don't really know why, but we've always done it this way. So we're on the phone, we're multitasking. Patients don't see that. They think we're talking to them. We're on the phone. We're like, what, can they not see I'm on the phone? So really just starting to really think about patients and satisfaction scores. And if that were your parent or if that were you, what would you want to see change? So now I'm just going to kind of open it up. We can, you can ask questions, you can give a scenario, anything you want just to kind of tie everything together. So if you want to unmute, you can unmute. I can give you some ideas if you want some ideas for just different ways to work at the front desk and training. Anybody have questions? You guys are always quiet. I think it's because it's Friday, right? So really thinking about how you at the front desk are operating and really challenging yourself to say, as a group, what can we do to be more efficient, to be more customer friendly? What's taking us a lot of time that maybe we can streamline so that we can spend a little more time smiling at the patient and thanking the patient. You saw in that video where the vet says to the lady, it was my pleasure. Those little words, thank you for coming. Thank you for being a patient. Those things spark up patience. We never know, especially in the type of patient population that you treat, we really have no idea if that's the first smile they've had this week, this month. So really kind of thinking about every day, what nice thing am I going to say to every patient that might make a difference? If you really set some goals for that, we have no idea what's happening in that patient's life, their home. So when they walk in and you're like, hi, Shelly, how are you today? It's so great to see you. that may have been the only person that was excited to see me this week in my mind. So really just kind of challenge yourself to come up with one nice thing to say to every single patient. How are you? The weather's great. Thank you for being a patient. How are you doing? How's your family? Whatever you can come up with that could change that patient's day. All right, any questions or anything you guys are doing in your health center that you want to share that others can benefit from? Maybe a change that you've made in the front desk or something you're thinking about? If you're thinking about something with a question, you know someone else is, so feel free just to unmute. Anybody? This is when everybody gets super quiet. So did you like the video? Is that something you think you could take back and share with other people in your health center? Nothing?
We did have something pop up into the chat here.
Okay.
Rachel says we moved our registration forms and fee scale applications online using JotForm, and it has been wonderful.
Nice. It's called JotForm?
Yes.
Nice. Okay. So that's a great tip for those of you that haven't done that. So if you haven't done it, maybe you want to look into that, or maybe even reach out to Rachel and just kind of see like how they transitioned. That's the thing, you guys, with the PCA is that you guys all have like common goals. You're kind of working towards the same thing. You have the same type of patient population. So working together to figure out what somebody's done and if it's worked, and if it's worked, how has it worked? And then that's something you can take back to your team as well. Anything else? Other questions or ideas that you've tried that have worked or that haven't worked? Anybody? You've still got a few minutes if you have questions. So even if it's not about what we talked about today, if you have any questions or you just want to like throw some ideas out there or ask for ideas. How many of you can put in the chat box, because it seems like most of you aren't going to want to go off and talk. How many of you are asking the patients the questions and typing it in manually in lieu of giving them a form for registration? So when I come in, it's how many of you are sitting across from me and saying, Shelly, tell me your address, tell me your phone number, and you type it in? Anybody? Or is everybody giving forms to patients? So you can just type in the chat box forms or verbally. Okay, so somebody said we've done away with forms except for a signature. So it looks like there's a little bit of a mix. Some are doing forms, some are doing verbally. All right, so how many of you are consistently asking for copays or deductibles or balances at the front desk? You can put it in the chat box if you don't want to talk. So you can put in yes, we're asking consistently, or no would mean we're not asking consistently. Okay, so I see somebody put consistently asking, so that's great. Continue doing that. That's wonderful. Somebody said they collect 20 to 30% of self-pay. Somebody else said they're required to ask at every visit. where somebody else put we're required to collect, but doesn't mean patients pay. Agree. You know, and even I don't know if anybody's if your team manager's on the call or supervisor, but even some put in some, you know, like challenges, some like, and this helps build your team as well, is to say, okay, if the team can look at your collections where you're at. And so like, let's say you haven't collected anything this year. You're not great at doing it at the front desk. It's too hard to ask. So then maybe say, okay, this month, if we collect from, I don't know, 50 patients, doesn't matter what we collect. If we collect from 50 patients, maybe your front off or your supervisor will do like a pizza party or something, or buy Jimmy John's or Subway for everybody. Start putting some challenges in as a team. Once you get really good as a team, then you can do some like individual challenges. Never do it by the dollar amount, especially if you're doing individual, because let's say it was Devin and I at the front desk, and if our supervisor said, okay, if you collect $50, well, he may collect $50 from one person. I may collect from 10 people, but not come up with $50. So I am a proponent of, let's collect from a number of people. So if you collect, whoever collects from 20 people this week gets, you know, a $5 Starbucks card or something. But just come up with different ways to incentivize each other. Start with teamwork and then kind of break it out for friendly competition. Make sure it's always friendly, but that's just a good way to start pushing people, and it makes you work together, and it makes you think about, hey, how are you able to collect from every patient that walks in the door? Versus somebody else is like, well, I'm having a trouble. So then I can sit with that person to figure out, what are you saying? How are you saying it? How are you getting people to buy in to collect every single time? So, you know, I sat with a girl at a health center, and she was fabulous. She would always say to the patient, she would say, you know, Devin, you've got a $20 copay, and Devin would be like, well, I can't pay. I've got to collect something today. You know, I cannot let you sit down without collecting. And she was like joking with him a little bit. But she did it with every patient, and she was able to collect right and left. And even if it wasn't the full amount. So just try to challenge yourself, even if it's an internal goal. Okay, I usually collect once or twice a day from patients, but I'm going to challenge myself to collect from 5 patients. Once you hit that 5, I'm going to collect from 10 patients. Really start challenging your own self. Write your goal down. If you don't write it down, you're not going to achieve it, because you're not going to look at it. Put it beside you every day. Say something nice and collect from 5 people. Next week, say something nice, collect from 10 people. All right. Any other questions, ideas? Nothing? All right, looks like Devin put the survey in. So if you guys can complete that, it helps us just make sure that you're getting the education that you want and need. So be honest on your surveys. If you think of other things that would help you or other ideas, you can always send those to Devin as well. I hope you guys have a great weekend. Hopefully it's going to be nice everywhere and everybody can get out and enjoy some fresh air.
Agreed. But yeah, with that, we do have a few minutes left, but I think that wraps it up. So thank you, Shelley, for putting on
Absolutely.
this series for us. We definitely appreciate it, and very awesome information. I learned a lot, even though I'm not even front desk. So
Good.
I'm hoping that's the same for everybody else. But with that, I think we'll wrap it up.
All right, guys, have a great weekend.
Bye, everyone.
Bye.